So this video is going to be about how to use MIPS to make it easier to find lung nodules. So this is a regular thin section CT. So again, as I'm looking for nodules, I'm basically looking for a nodule of tissue to catch my eye amongst all these branching pulmonary vessels. So one way to make that a little bit easier on the eyes is to use MIPS. What MIPS do is they display the vessels as branching structures, and it makes it easier for me to pick out that nodule amongst all those branching structures. Another way to put that is that it increases my signal to noise ratio and makes it easier for me to find lung nodules. So you saw the example of the regular thin section CT. This is what MIPS look like. As I scroll up and down these MIPS, you can get a sense of what these MIP images can show you. It shows you all these delicate branching structures, the pulmonary arteries and the pulmonary veins, and it shows you how they branch throughout the lung. And you can see that if it had a nodule hiding amongst these branching structures, it would kind of catch your eye a little bit better. And again, it would increase your signal to noise ratio. So what are MIP images? So MIP stands for maximum intensity projection. So each image that I'm showing you here, each image has within it 8 millimeters thick of tissue. So these are called slabs as opposed to slices in regular thin section CT imaging. So in each slab, I'm going to be displayed the pixel along that ray of 8 millimeters. It's going to display the pixel that has the highest density value. In the lungs, since air is so not dense and pulmonary vessels are relatively hyperdense, it's the pulmonary vessels that will be displayed as these branching vessels. So I really like MIPS. I think they're aesthetically pleasing. I like looking at these branching structures in the lungs, and it really helps me to find lung nodules, especially lung nodules kind of in this peripheral area of the lung, what I'm kind of drawing out with my mouse here. So now I just want to show you these MIPS in action. So here's a thin section CT of the chest, and as I'm scrolling, I just want everyone to just kind of focus right here. There's basically two small subtle little nodules that are there. You can see this one right here, pretty subtle small little nodule, but definitely there. And as I come down a little bit lower, there's another nodule right here. So how can I make it easier to see these nodules? Well, I can use MIPS. So now I'm using 8 millimeter thick MIPS. I'm scrolling down in the same area, basically looking in the same direction. And now you can see that nodule. It sort of kind of picks up as an area of round density amongst all these branching linear vessels. So it kind of makes it a little bit easier to see that nodule. As I keep coming down, we can find that other nodule there. You kind of see that there's this branching structure, and then it gets focally larger right there at the nodule. So again, making it a little bit easier for me to see that nodule. This is an example of how MIPS make it easier to find lung nodules. Keep in mind that they're still going to make it difficult to find those hilar nodules because those large branching structures here could possibly obscure a subtle nodule. So I still use the regular thin section CTs to review the perihilar regions. So there you go. That's using MIPS to make it easier to find lung nodules. Sorel Garmd. Take care.